What if you could spend just minutes a day on a safe, simple exercise at home and finally gain control of your leaky bladder? I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. In this video, you'll find out how Kegel exercises, when you do them correctly, can stop leaking and incontinence and get you the control you need. First of all, real Kegels does not mean Kegels with a device. This is just one example of a Kegel device. There are ones that there are all kinds of shapes and sizes. There are some that look like a Klingon torture device, some that look like a garlic press, some that look like an anvil. There are so many different things. And the people selling the devices will tell you you have to do Kegels against something you squeeze. It's not true. Kegels also are not what a lot of people say, including doctors I've personally heard say 200 Kegels a day anytime you get to a red light. No. Also, real Kegels are not an hour-long, complicated program from a physical therapist with a million different exercises in it. In the Kegel Queen program, you get a 3-minute workout that you can do at home with your pants on. Here's what real Kegels can do for you. Kegels are exercises of the pelvic floor. So let me show you the pelvic floor. This is your pelvis, and this bowl of muscle here is the pelvic floor. These muscles. The pelvic floor has a lot of jobs to do in the body, including pretty much deciding. It works with your bladder and your bowels, but the pelvic floor is kind of the big decider, controlling when you pee and when you don't. When you do Kegel exercises correctly, you get better control of these muscles. You get stronger muscles, so they work better. When your pelvic floor is better toned, it actually raises the position of the pelvic floor within the body. So the pelvic floor moves toward the center of the body like this. And what that does is it improves the angle between your bladder and your urethra. If you think of the bladder as like right where your urine hangs out before you go, your urethra is the tube that lets it out. And normally there's an optimal angle that when you're not peeing, it functions kind of like a kink in a garden hose. And when you do Kegels correctly, you build up the pelvic floor to help maintain that correct urethral angle. Kegel exercises are safe when you do them correctly, and they have just one side effect. Wait for it, better sex. Unlike surgery or drugs, where the side effects might be something like horrible pain or all kinds of other things you don't want, the side effect of Kegel exercises done right, better sex. What's not to love? And all it takes is minutes a day. To find out how to do Kegels correctly, you're not going to learn from a magazine, you're not going to learn from a TV show. Even 99.99% of women are doing Kegels wrong, even if they learned from a physical therapist, a childbirth teacher, or a doctor. To find out more, go to kegelqueen.com. I'm the Kegel Queen, and I'm here to help.